Nebraska is projected to have about 500 new cases of COVID-19 a day by August. That's according to the University of Washington's Institute of Health Metrics and Evaluation. This afternoon, a panel of physicians and health experts at CHI Health talked to us about what they've learned so far from the virus and what they're expecting. Reporter Phil Bergman shares their insight.
As CHI Health is preparing for a second wave come fall, the hospital system touted its work during the first wave, saying clinicians managed it at an effective manner.
We are not an ivory tower. Our goal is to deploy our resources where there's the greatest need so we can do the greatest good.
CHI officials said they've cared for 621 patients with COVID-19. As of now, there are 61 patients with COVID-19 at their hospitals, with 17 under investigation. The hospital system said they didn't face shortages of supplies.
This early preparedness really allowed us to be prepared and not get overrun in our hospitals.
Compared to other coronaviruses, doctors say COVID-19's possibility to spread before people develop symptoms makes it harder to contain. Doctors are also noticing a downward trend in the age of positive cases.
I think one of the somewhat surprising things we've seen is just the impact of obesity and diabetes, especially in some of these younger patients and the severity of illness those patients present with.
As states across the country are loosening restrictions, the doctors said it's still important for people to practice social distancing and wear masks.
But it's not gone, and we need to make sure that we don't do what we can. We need to make sure we do what we can so that it stays controllable.
Dr. Quimby added there probably will not be complete control until there's an effective vaccine that's accepted by the population. This may be tough since people still have concerns about long-standing vaccines like the measles.
Our job as providers is not to judge our patients, but to educate our patients and allow them to make their own decisions.
COVID-19 has already killed 121,000 Americans, and the number will continue to rise heading into the fall. The physicians say we need to take this pandemic seriously.
But as a society, and for sure as an organization, as a healthcare system, we're preparing for this may be something we have to live with for years to come, and we're going to continue to deliver great patient care.
Reporting in Omaha, Phil Bergman, 3 News Now.
The CHI Health Core Lab has done 20,000 coronavirus tests with 2,400 positive cases. By August, the Health Core Lab will double testing capacity. One of the doctors added he hasn't seen a large uptick in volume due to protests.